We all know that medical misinformation spreads so fast these days. So today we invited Emmy award-winning journalist, medical doctor, professor, and author, Dr. Seema Yasmin, to talk all about some medical myths. So Doc, thank you so much for joining us here on DBL.
Thanks for having me.
Yes. Okay, so let's get right to it, because you have a book called Viral, what we're referring to as Bleep, Medical Myths and Why We Fall for Them, that dissects some of these medical myths we're about to talk about. So let's start with this one. Mammograms cause more problems than they detect.
So I'm a public health doctor. Screening saves lives. Make sure you talk to your doctor and get your cancer screening on time. The important thing to keep in mind, though, is there's always a downside to interventions like this. And what we worry about sometimes is maybe people start screening too early or get screened too often. And then what can happen is a slippery slope of biopsies and tests that can lead to overdiagnosis and overtreatment. So that's why it's really important to talk to your doctor, be honest about your lifestyle and your risk factors, and figure out a screening protocol that's right for you.
All right, Doc, we're going to have a quick true or false here. Older adults are at higher risk of contracting STIs, or sexually transmitted infections.
That is true. And there's a couple of reasons. One of them is we're kind of weird as a society. We don't admit that people still enjoy healthy sex lives into their 60s, 70s, and beyond. So doctors are not having those frank, open conversations about safer sex. And meanwhile, we've seen rates of STDs like chlamydia, gonorrhea, and even HIV increase among older adults. So really important for anyone watching this, but in the healthcare profession too, don't let your assumptions get in the way. Have that conversation. As we get older, our immunity can drop a little and it can make us more vulnerable. So really important to have those conversations.
Here's an interesting one from your book. And, you know, as physicians, I feel like we get this question all the time. I'm sure DBL Nation is excited to hear your take on it. But you are more likely to die from a medical mistake than a car crash.
This is not true. And this is one of those myths that came about from a study that kind of wasn't a great study. It looked at a small number. It took one measurement, extrapolated it to the whole of America. And then unfortunately, the media ran with these really scary headlines. So this is patently false. And the reason I'm so glad we're debunking it is because it can have a real life effect on people. You know, there's someone out there, they have some chest pain and they start worrying, I don't want to go to the hospital. I've heard you're more likely to die from a medical mistake than even from a car crash. It's not true. Get checked out. And unfortunately, sometimes these studies do lead to misleading and scary headlines.
I'm with you. Studies are stupid.
Not all of them.
So how about this one, Doc? Maybe you could keep a couple bucks in my pocket. I'm sick of paying $2 more for oranges. $2? Organic food is more nutritious for you than non-organic food.
But doesn't it make you feel better to fork out a little bit extra? I did exactly this yesterday. I spent a couple of dollars more for organic milk, even though I know the answer to this is that it's not true. Nutritionally, it doesn't make a difference. Organic foods, they've done loads of studies on this. They have less pesticide residue, less likely to be made using hormones and antibiotics. But from a nutritional perspective, it's equal, organic versus non-organic. But like I said, kind of made me feel good. I felt a little smug, a little healthier. But from a scientific perspective, it doesn't make sense.
Got it. So studies in organic food, stupid.
I mean, that's a big
That is not the takeaway.
I totally got it. I'm just joking around with you, Doc. It's Friday. Thank you so much. Dr. Seema Yasmin, again, thank you so much for joining us. We're children over here, so the professionals, thank you. To our viewers, check out Dr. Yasmin's new book, What the Fact, Finding the Truth in All the Noise. And for more medical myths, you can get Dr. Yasmin's other book, Viral Bleep, as we're calling it, Medical Myths and Why We Fall for Them, wherever books are sold. Thanks for rolling with the punches, Doc.
Thank you.
Thank you.